I typically see patients after they have been diagnosed with breast cancer, though at times I see patients who present with a palpable lump or bloody nipple discharge or skin changes that they're concerned about that haven't been worked up yet. In that case, I would set the patient up for diagnostic imaging. That might be a diagnostic mammogram or ultrasound. In some cases, it's a breast MRI, and then biopsy would be performed if it was appropriate. Once patients have been diagnosed, I sit down with them here in the office, oftentimes with friends or family, and we discuss the diagnosis and their surgical options. There are typically just two options, lumpectomy, which is removing the cancerous lump with a rim of normal tissue around it, or mastectomy, that's removing the entire breast. That may include removal of some of the lymph nodes under the arm on the affected side. That's true for lumpectomy as well. It depends on whether the patient's been diagnosed with a non-invasive cancer, like something called ductal carcinoma in situ, DCIS, or an invasive cancer. Patients with non-invasive tumors typically don't need any lymph node evaluation. We sit down and discuss the tumor size. For patients who have smaller tumors, then typically lumpectomy is a very viable option, though some patients might decide to undergo a mastectomy for their personal or emotional reasons, not necessarily medical reasons. For patients with very large tumors, or a tumor that's large when compared to the size of the breast, they may opt for mastectomy. We didn't discuss it, but the alternative to that might be doing chemotherapy to hopefully shrink the tumor, and we can sometimes take a patient who is not the best lumpectomy candidate and by switching the order of the treatment, reduce the size of that tumor and allow them to undergo a lumpectomy if they desire to preserve the breast. Once we've decided on our surgical procedure, I take patients to the operating room and we perform either the lumpectomy or mastectomy and the lymph node surgery as indicated. I just want patients to know that breast cancer, when caught early, is curable, that we have many surgical and medical options for patients, whether it's chemotherapy or a once-a-day pill that patients can take. There's reconstruction for patients who want to undergo mastectomy but feel that they need a breast to maintain their self-image. There are a lot of options, so the fear of finding something in the breast should not prevent a patient from doing a self-exam and undergoing their annual mammography. And certainly if you have a really strong family history of breast cancer, you need to discuss what kind of screening is appropriate for you with your primary care physician, and perhaps even consider genetic testing.